Okay, let's go straight to our discussion tonight so that people will learn some things. We're talking about blocked fallopian tubes. Blocked fallopian tubes. Time and time again, people have asked the question about blocked fallopian tubes. We need to understand what this thing does. Rock and Tari. She said she's running. As in talk fast, I beg. My battery don't dey go. All right, ma. I will do that. All right, I will talk fast. All right. So if you are just joining, we are talking about blocked fallopian tubes, right? In the direction of when fertility fails, not because there was egg problem, yeah, not because there was egg problem, but because the highway or the journey, the tunnel with which the egg would wait for the sperm and the embryo would travel to implant is blocked. When the expressway is blocked, now causing a lot of fertility challenges. That is the matter. Why? Because you have a woman can ovulate normally, right? Check her hormone. Her hormones are fine. The period comes regularly. Her uterus looks healthy. Yeah, Lucy, you're welcome back. You keep going and coming, right? So her uterus looks healthy, yet pregnancy does not happen. Is that your case? You're in the right place. So let's talk about it. Because it's not every time there is infertility challenge that egg is a problem or sperm is a problem or even ovulation problem. No, it's not every time. Rocking Atari, next time you make sure you charge your phone very well. Monday to Fridays, charge your phone very well so that you have enough battery for the live stream, right? So I was saying that sometimes some infertility problem is not just poor quality egg, no ovulation or sperm problem. No. Sometimes the problem is actually the pathways between the ovary and the uterus. That may just be where the problem is. May just be the fallopian tube, because the fallopian tube is the highway. Okay, Ragnatar, I see. So this fallopian tube, which a lot of people have no idea about, or if they do, they really don't know how it behaves. As tiny as it is, really talked about. Good evening, Maya. Maya is here. As tiny as it is, rarely talked about, but is very essential to natural conception. And you see, when these tubes are blocked, right, or when they are blocked, or when they are damaged, or when they have some functional problem, fertility problem, will trouble you for a very long time, right? So let's jump right into the gist so that those people where your battery won't end will learn something, right? So as usual, let's start from the very beginning, right? What are fallopian tubes? You know the joke I gave earlier? What are fallopian tubes? If you are just joining, you're welcome. Make sure you share this live to somebody, to every woman in your life, because they are supposed to know. Right? So what are fallopian tubes? Simply put, fallopian tubes are thin muscular tubes that connect the ovaries to the uterus. Now, I'm sure when you attended your biology class or maybe in the hospital they were drawing fallopian tube for you, you saw a straight line, right, from the uterus towards the ovaries. Well, for the purpose of no, I don't. From next year I'll start doing all that, but for now, just enjoy this one. Right? Yes, fallopian tube connects the ovaries to the uterus. Right? But when they draw it for you, they just draw a straight line. But it's not so. That thing is actually not straight. Right? It's not straight. Don't worry, one of these days I will bring video to show you what it looks like in real time. What your fallopian tube looks like. Right? But I said all that to say that this thin muscular tube that connects your uterus to the ovaries, they are not just there, right? They're not just there. They're not passively there. They're not passive tunnels, right? They are active, alive, and moving because the fallopian tube have peristaltic movements. Beside the fact that it's not just straight, right? It has movement like this. The same way your bowel moves peristaltically, is the same way the fallopian tube moves. I tell you, that thing that is inside woman's pelvis is a whole universe on its own. Right? You cannot know that and not appreciate. Okay, let's not go there. But that is what it is, right? Now, this behavior or this normal peristaltic movement. Hey, Ivy is here again. You're welcome. Good evening. So this movement, peristaltic movement of the fallopian tube actually helps it to participate actively in capturing the eggs after ovulation. Remember what I said yesterday. If you were here yesterday, you learned, I'm sure you learned a lot. Remember what I said yesterday. Let's say this is the ovary and this is the fingers of the fallopian tube, like this, right? It is not just like this, like you see on your textbook or the way they draw it for you. No, it's not like that. This is what it's doing. It's always doing this. You know what those fingers are looking for? They're looking for the part of the ovary that is bulged out. Because the part of the ovary that is bulged out would have the dominant follicle, the largest follicle that will rupture and give out egg. Because this fallopian tube is looking to capture egg and transport it inward. Did I confuse anybody? If you understand, just talk to me in the comment section. Just type understand. I want to be sure I did not confuse somebody. So that's what the fallopian tube is always doing. Right? Actively there. Yeah? Did you understand what I just said? All right. So that is part of what it does to help capture egg after ovulation. Besides the capturing of eggs, it also, that movement, because the whole tube is doing like this, right? That same movement helps to move sperm forward, right? So the sperm too get some help from those movements. It helps to move it forward so that it can quickly reach the egg for fertilization. So that is one of the way the fallopian tube supports. You will not hear this one anywhere, so just learn it. So that's one of the way the support for fertilization happens. Now, when the fertilization did happen, right, embryo begins to form. That embryo needs to travel from that spot in the fallopian tube to the uterus. So what happens? The peristaltic movement continues to move like this. So what does it do? It helps you to push towards the uterus, right? Now, see this thing I just mentioned. Natural conception is heavily dependent on it, right? Heavily dependent on the function of this fallopian tube. That's why I don't want to miss the session. Thank you. Now, this surprises many people. Let me tell you something that surprises many people. This fertilization that we're talking about happens inside the fallopian tube, not in the uterus. The uterus serves the purpose for which I said when I was talking about uterus. So go and look for the video in my YouTube channel and watch it, right? But fertilization happens inside the fallopian tube, right? Now, after the fertilization happens, that fertilized egg, which has become an embryo, will move towards the uterus, where the baby will be formed afterwards. Is that okay? So this is how the tube works normally. After ovulation, the egg is released from the ovaries, right? Then those this finger thing I told you, they will gently sweep the egg into the tube, fallopian tube. For in some cases, that may not happen. Remember when we're talking about endometriosis, what endometriosis will do, right? It causes some kind of structural disruption, so much so that there's no proper alignment between the ovary and the fallopian tube because of adhesion. So when that distortion happens like this is the ovary ovulating here, and this is fallopian tube doing its own thing here. So you're already in a mess, right? I do that. All the live streams are on my YouTube channel. The full video, or actually edited part, right? Where I remove all the gist, right? So they are on my YouTube channel. When you go to YouTube channel, Dr. Godwin EMB, tonight, yesterday's live stream will be airing tonight by 10 p.m. So you can go there. Don't worry. By Saturday, this live stream will be there. So if your battery goes off, no problem. It's all right. So the finger-like ends of the fallopian tube will sweep in the edge, right? Now inside the tube is where the fertilization will take place. Then the embryo that is formed from that fertilization will have to travel from that point into the uterus. But let me stop here and ask another question. I did not forget yesterday's question, but I want to ask today's one. At the end of this live stream, I want to ask, please, if you have to write it down, write it down. At the end of this live stream, somebody should tell me. Anytime there is, in the case of ectopic pregnancy, right? Where is the most common location for ectopic pregnancy? You will use Google, I know, but the question is why. So that's the most important part of the question. Why? So if you know where the most common location is, you need to tell me why. So that is the question for today. Should I repeat the question, or I should just continue? Or let's just pretend that there's no question. Right? Should we pretend that there's no question? All right, so by the end of the lesson, we'll talk about this question. Christy LaBelle is here. So this is basically this Akua Otiwa. Okay, you'll be here. I see. So this is basically what happens with and all these movements of sperm this way, egg this way, fertilization happen, and embryo moves this way. All is because of the dynamic nature of the fallopian tube. The fallopian tube is not just there, static. It's not passive. It's actively involved in your everyday life. Oh, precious fallopian tubes. But let me tell you something. For it to function properly, the fallopian tube is required to be open. It's required to be healthy, right? The lining should be healthy. Its function should be healthy. Even the muscular activities, so I will not go into those details. Then there are some other actors inside the fallopian tube that play their own role, and they are how do you call it now? They are tiny hair-like structures inside. So the fallopian tube inside of it is not as smooth like this. No, it has hair-like structures that are projecting out of the wall. And what do? They beat. They beat. Right? So when you have blocked fallopian tube, it will disrupt any of all these activities. So when you hear blocked fallopian tube or damaged fallopian tube, it means that one or all of all these activities is impaired, is damaged. So what does even this blocked fallopian tube that we are crying all over the place, what does it actually mean? Good evening, Queen Josie. Good evening, good to see you. Okay, what does this blocked fallopian tube actually mean? What does it mean? Right. So who's ready for that gist? Talk to me in the comment section. I want to see the comment section moving. I want to see the comment section moving. You right? Good evening, I see you. What does blocked fallopian tube actually mean? It's very simple, right? A blocked fallopian tube means the normal pathway I described earlier is interrupted, right? Just imagine you are traveling and in your journey you are supposed to pass a tunnel, and for some reason the tunnel is blocked, or maybe there was an accident and the whole place is so it interrupts flow, right? And this blockage can either be partial blockage, complete blockage, right? It can be one side, because fallopian tube is two, right? It can be one-sided fallopian tube blockage or the both side blockage, right? It can be. And the location of the blockage matters a great deal. Oh boy, don't miss this gist tonight. So we're going to be looking at, yes, bilateral tube blockage. That's if the both side is blocked. So we're going to be looking at this blockage in details, right? Then we'll now answer the question, what can cause the blockage? So let's look at the detail of the blockage. Now, there is the what you call proximal blockage. Proximal means near. Should I add something to your vocabulary this night? Okay. When you use the word proximal, it means that what you are trying to describe is near to the origin, right? So fallopian tubes begin from the uterus, right? So if there is a blockage that is close to the uterus, you say proximal blockage. If there's a blockage that is far from the uterus, you call it distal blockage. That's just for your education, but just know that there's something like near blockage and far blockage. Is that okay? So this proximal, which is near blockage, will be blocked close to where it joins the uterus, right? I think maybe one or two of those people are here. If you're here, go back to that your film again and look at it. Right? Go back and look at it. You understand what I'm talking about, right? So I said all that to say that sometimes this blockage can be caused by inflammation, spasm, or even scar tissue from damage, scar tissue that emanates from repair of damage. Is that okay? So that is near. Distal is far. In other words, anything that is far from the uterus will be close to the ovaries. So when the blockage is close to the ovaries, we call it distal blockage, right? The far end of the fallopian tube becomes sealed, right? Sealed. And when that happens, it may lead to what we refer to as hydrosalpinx, that is accumulation of water in the fallopian tubes, right? So this is the case where you can have that, because the fallopian tube is not just a dry tube, there is fluid inside of it, right? So this condition of far blockage can significantly affect implantation. It can affect your IVF success. Listen to me. I know you have an option of IVF, but listen to how fallopian tube blockage can impact the success of your procedure, so that nobody cry premium tears, right? And also, of course, if it can affect IVF success, it can also affect natural fertility. Is that okay? So that is near blockage, far blockage, and there's another one, functional tube damage. Right? If you're just joining, you're welcome. There are things we've said before you came, so just try to understand, right? And if you're not following me yet, follow me, because you need the information I share, right? So this one they call functional tube blockage. Sometimes the tube, right, may be open, right? So yay, my tubes are open, but you still have fertility challenge. Right? So sometimes the tubes may appear open, but yet its function is poor. Remember what we said about the function? Yeah, that's why you should not come late to the live stream, because you miss good information. So the function may be poor, right? And if the function is poor, it will mean that the ability of the fallopian tube to pick up egg will fail. It will fail. So the tube shakara herself too much. Everything in a woman behaves like a woman, right? So of all the genders, who does shakara? Women. So everything about them must do shakara too, right? So this functionality that now has a problem will affect how the tube picks up eggs, right? Remember those hairs I talk about that are inside the fallopian tube that beats like this? They can also be damaged, and depending on the extent of damage, their function is lost. So where there is no support in propelling the sperm to the egg or propelling the embryo to the uterus, you already know what happens. It may come too slowly for implantation. And remember, fertility is timed. It's timed. That's why you see this your embryologists. You must give them kudos, right? When from the day they retrieve your egg, it is a countdown to transfer, right? Because you cannot now say, okay, I'm supposed to go back and check the embryo, then prepare for transfer. Then I'll say, okay, let me wait until I finish live. I cannot wait until I finish live stream. I will have to go there when I'm supposed to go there, right? So embryologists, they don't have time for themselves. The day they retrieve that egg, no more time. And imagine if they have to do that for many people at different time of the day. Anyway, just to give you an idea what's going on. So don't just think that when they take it, they go and sleep. They don't sleep. If it's at the midnight, they are supposed to check it, they will have to be there. There's no story of there was hold up. There's no story of my wife just born. There's no story of... Why? Because the loss of an embryo is tantamount to abortion. Okay, let's not go there. All right, let's not go there. All right, so what was I saying? Yes, that's what it means. If for some reason I'm carrying or handling an embryo and I make mistake and that embryo is destroyed, I have committed an abortion. That's what it is. So that's why that place is like a shrine. Nobody goes there anyhow. All right, where was I? So I was talking about when those hairs inside the fallopian tube are damaged, it means that either the support for sperm and embryo movement is lost, or it will be too slow. And if it is too slow, it means that it will not meet up with the biological timing for implantation. Remember, implantation has window. The same way you have fertile window, there's also implantation window. If the window is missed, forget about that pregnancy. It's not going to happen, right? So these things I'm talking about now are things that are hardly would anybody pay much attention, but you have to pay attention. So your doctor will pay attention for you, right? So we cannot afford to have damaged fallopian tube. That's what I'm trying to say. Whether it is blocked or damaged, it's not bargainable. All right. So what really causes tubal blockage? What causes tuber blockage? Please share the live. Before I go ahead, share the live. Share the live because some people need this information. What causes tuber blockage? Just imagine somebody who may be guilty of some of the things I'm saying now. Please share the live. Somebody may just be guilty of what I'm going to mention. That is why. That's why I'm insisting we share the live. So that they may just stroll in while I'm talking about them. Right? Because what I'm saying now is the biology behind the damage of fallopian tube. Everything about a woman is precious. But sometimes they need to behave well, right? Everything. So I think we should double bride price moving forward. If village people hear this knowledge, the bride price will go up like this. All right. So we're talking about what causes tuber blockage. Now I will not tell them so that they don't will bill me too. Me say, I be man, I will pay bride price like mad. So we'll keep the knowledge to ourselves. So what causes tuber blockage? Yeah. Mild and soft, I see you. Welcome. So number one, PID. Somebody, I think the person I was talking to this night. Are you still here? If you have gone, I will ban you from the live stream. You are not supposed to go. Anyway, number one is PID. PID, the famous PID, right? PID means pelvic inflammatory disease. Is that okay? And this is one of the leading causes of tuber blockage globally. It is the chief cause of tuber blockage, right? Why? Because when infection happens, it may cause inflammation, scarring, and adhesion. Right? So that is the reason why it is the chief cause of tuber blockage. Remember, if there is scarring in the tube, it will result to adhesion. Even the scarring that does not result to adhesion must have damaged all those structures that are supposed to support the movement, right? So even if after the symptoms of PID disappear, tuber damage may just remain there silently. You didn't even know. That's why I tell young women especially, do not play with slight signs. Do not say, now so my body. If you suspect or there are subtle signs of infection, go and treat it. Because that small thing that you are overlooking may become your worst nightmare in years to come. Right? So the symptom may have disappeared. You say, no more PID. But the damage is waiting for you in future. Right? So that's why when you want to treat properly. Don't do half measures. Don't do uneducated approach. When I say educated, does not necessarily mean orthodox. What I'm saying is that treat it true and true, right? It's very important. So that is the first cause of tuber blockage. Cause number 2, STIs. Those people like to knack with no good. But now you are knacking with infection. That's sad. That's sad. That's sad. STI is the second reason for tuber blockage. Right? Thank you very much for the gifts. Especially untreated infections like chlamydia, right? Gonorrhea. Oh boy. Don't play. You know, I remember years ago when I was much younger, when we watch those American movies and they do these medical scenes where somebody will say, I went to the clinic, they say I have chlamydia. It was right? Everybody's afraid of chlamydia, right? This is the reason. Right? Because this may damage your tubes quietly without any dramatic symptoms. Untreated infection. Don't play. Don't play. Anyway, so that is the second thing. The third thing is what I talked about yesterday. Endometriosis. The notorious endometriosis. Why? Because endometriosis can cause adhesion, and the adhesion can lead to distortion of the anatomy, just like I explained earlier, right? And even tuber scarring. You understand what I'm saying? So when that kind of distortion happens, the transporting of egg. In fact, if egg is to be transported at all, it will go somewhere else because the anatomy is distorted. Right? So it will lead to inefficient fertilization, right? So endometriosis is the third reason, third cause of tuber blockage. Yeah. Then this one, which may not necessarily could have been your fault, but is there, is for those who have gone under the knife before, there is previous surgery, right? Pelvic or abdominal surgery may sometimes would have led to scar tissue formation, right? Or adhesion around the tubes. You see that thing people used to say, that after my surgery I have not been able to conceive, and they are blaming the surgery. Well, their reasons may not be correct, but previous surgery can actually cause tuber blockage as a function of scar tissue formation and adhesion that can happen in the tube. Good evening, Safinat Momodu. Right? Previous surgery, which will also include previous ectopic pregnancy, right? And the problem with ectopic pregnancy, you have history of it, you have higher risk of another one. You know, I've had patients like that. Within the space of 8 months, she had 2 ectopic pregnancies. One on this side, taken out. Now it's occurring on this side. This one has passed. It has gone beyond village people. Right? It has gone beyond village people. It's unfortunate. You'll be amazed the kind of thing that goes on out there. So that's why when you pray well. And also pray for me so that I go no book where to come and teach you, right? Okay. Okay. Now, many people usually, which is not out of place, they will panic immediately they hear things like one tube is blocked. Oh my God! You will not blame them. That's what normal human being would do, right? That's what a normal human being would do, right? But the truth of the matter is, pregnancy may still happen naturally. Can evacuation cause? Pregnancy may still happen naturally if the other tube remains functional, right? Why? Because ovulation occurs on the functional side. So remember, I think there was somebody we were talking to on the live stream, and I said this to her. I'm sure she's taking advantage of it. So yes, the unilateral fallopian tube blockage does not automatically mean that you are infertile. Your chances just reduce, but the other side can actually do the job. Is that okay? Christy LaBelle, not all the time. Not all the time. I'm still dependent on the indication, right? Depends on the indication. Not all the time. But in rare cases, it can. Especially those people where we say they were carrying remnant of conception and refused to take quick action, and that started developing abscess and all those kind of things, right? So not all the time. So depends on the indication. Yeah. You have to prove that it was not blocked before the evacuation, right? But yes, that can happen, but not all the time. Is that okay? So now, when the both tubes are blocked, wahala, right? When the both tubes are blocked, I can guarantee you that conception becomes extremely difficult. Why? Because sperm and egg cannot meet normally. Where they won't see the road, embryo transport becomes impossible. Even if the sperm see road pass, where will the embryo? Remember that egg is larger than, I think, 100 times or more larger than sperm. So even if the sperm find road, go fertilize the egg, where will it see the road to pass? So you can see it's a lot of problems, right? It becomes, the embryo transfer becomes very, very impossible. In such cases, the solution will be IVF. IVF becomes one of the major fertility options in bilateral tuber blockage, right? Because what IVF does is it bypasses the tube entirely, right? So what would have happened in the tube, they did it in the lab, then transfer it back to your uterus, and life continues from there. So if you have bilateral tuber blockage, do not cry. Do not cry. Take the other option and you'll be fine. Is that okay? Okay. If you do have probe, it's fine. Okay. All right. So I mentioned something earlier about hydrosalpinx. So remember that word. I mentioned hydrosalpinx. It's actually a very dangerous situation or condition, right? And people should give attention to that matter. Now, hydrosalpinx actually, if it's there, It actually would occur when there is damaged tube or tube. When the damaged tube is filled with fluid. Yeah. The reason why it's concerning is because this fluid may leak into the uterus. You cannot have hydrosalpinx and you go ahead with your IVF procedure. No. Or you're expecting that you conceive naturally. No. Because this fluid may leak into the uterus, and that's the source of concern. Fluid in the uterus will affect implantation. As nobody will do embryo transfer for you when there is fluid in your uterus. Nobody will do it. Unless that person just wants to. Nobody will do it. I don't think that kind of person exists. Unless the person don't know what he's doing. Right? Why? Because even if it's the embryo gets there, its survival will be impaired. If the survival is almost zero. Right? So that's why hydrosalpinx or fluid in the uterus will reduce pregnancy success dramatically, even in IVF. So hydrosalpinx is not your friend, and hydrosalpinx can occur when there is damage or blockage of the distal end of the tube, and now fluid is accumulating in the fallopian tube. All right? Who is confused? If you are confused, I can stop you. But if you are not, let's continue. See, blocked tubes, right, can sometimes have symptoms and sometimes will not have symptoms, right? You have blocked tubes. You may never know until you have struggled for many years trying to conceive. Then they go and do HSG. You have blocked tubes, symptomless or asymptomatic. But if there is symptom, the possible symptoms that could present will be maybe pelvic pain, chronic discharge, pain during intercourse, when you are knocking waiting no good and you are feeling pain, right? And of course, previous history of infection. So these are the possible symptoms if this blocked tube has symptoms, right? But in most of the cases I've seen is asymptomatic. So it's when the people have suffered for a very long time, they now discover that, oh, my tubes are blocked. Then they now begin to look for solution, right? So for those who don't have no symptoms and you've been trying to conceive, you've done everything that you're supposed to do, but you have not done HSG. Tomorrow we'll talk about HSG as an episode. So I will tell you some things about it. Is that okay? So where there is no symptom, it makes the whole thing look very deceptive, and you're doing everything you need to do. And after many years, maybe 5 years, 10 years, you just discover that tubes are blocked. Then you go back and start looking for solution. Tabs Mobile is here. Now somebody asked the question. He said, okay, if there is blocked tubes, how would they diagnose it? I know that is your question too. Thank you, Mr. Tabs. Thank you. I will not answer it. I want those in the comment section, ask me the question. How do we diagnose blocked tubes? Ask me. Ask me. If you don't ask me, I will not talk. Make I do shakara too. Maybe women they do shakara. Me, I will do my own. Ask me. I'm not saying the question also. This one aura for aura, shakara for shakara. Who will blink first? Mr. Taps, you see what I'm going through in the hands of women. This is shakara for shakara. Facts organic, you're welcome. So before I continue, ask me the question, how is blocked tubes diagnosed? All right, we'll jump it. Let's jump it to another thing. And this is very important. Very important. Right? I remember one time, was it earlier this year? Earlier this year, somebody was asking the question whether blood tubes can be unblocked, right? Can tubes be repaired? Now that we have discovered it. Yes, HSG is one of them, Christy Labelle, yeah? But that's not the only thing. So I'll leave it for everybody to go and find out by themselves. Since we are doing aura for aura, I do shakara, you do shakara too. All right, let's continue. Can blocked tubes or can tubes be repaired? The answer to that question is, if you were here, you already know. The answer to that question is sometimes. Sometimes it can be, right? Sometimes it can be, and it's dependent on the extent of damage. It's dependent on the location of blockage. Is dependent on the severity of the scar tissue that is causing the blockage. So these are the factors that will determine whether the blocked tube can be unblocked. Right. And the options you have, if you have to unblock it, will be maybe adhesion removal or even a surgical repair. Right? Right. If you are just joining, you're welcome. I see you. If you're not following me, you want to follow me now. Right? And even with this repair of maybe surgical repair or adhesion removal, even with that, it's still dependent on the severity, right? Because in the end, after the repair, the tube may remain functionally poor, and a poor functioning tube will still have problem with the transportation, efficiency of transportation. Right, so these are the issues. If you are just joining, you're welcome. You've missed too much to understand what I'm saying. So you want to go to my YouTube channel, Dr. Godwin ENB, up here. Go there, search anything on fertility, you'll find it. If you cannot find it, wait till December. We would have uploaded it, right? Yes, so that's how to repair fallopian tube blockage. Surgical repair or just scar tissue removal, right? So these are the two ways. And by the way, I don't want to say it before then, because we are talking about HSG tomorrow. So there are some things I want to say about HSG. So I will not say it here now. All right, so damaged tubes increase the risk of ectopic pregnancy. That is the second part of the question I asked earlier. And the question is why? The first part, who remember the question, the first part of the question? Nobody can remember? The first question was what? Anyway, so the second part now is damaged tube increase the risk of implantation. The answer is, the question is why? Right? All right, if you have a question, send in your requests. Let's answer your question. It is important